Hello, and welcome to Achieve TMS East Virtual Open House. Normally, we host these open houses at one of our many convenient locations. At this event, you can meet members of our team, including the technician for that office. And the best part is, we have tons of food and drinks for you. But obviously, this is a virtual tour, so hopefully you brought your own snacks. This is the deep transcranial magnetic stimulation machine manufactured by Brainsway that we use at each of our offices. Now we will show you what it looks like for a patient who is getting set up and receiving treatment. As you can see, the technician is placing a blue cap on the patient's head. Each patient gets their own blue cap that stays with them from the first appointment to the last. This first appointment is called a cortical mapping. This mapping is done by the technician and one of our psychiatrists. This mapping determines each patient's coordinates, which is where the therapeutic pulses are directed each appointment. Once the patient has been set up properly, the tech will count them down and begin treatment for the day. If everything feels okay to the patient, they will sit through the treatment for about 20 minutes as usual. Once they are done, the patient can leave on their own and drive to their next destination. Now, let's ask the patients how it felt.
It didn't hurt. And if I started feeling uncomfortable, I would tell my technician, and my technician moved or adjusted the helmet.
And everything is painless up front. Sometimes, it's a little annoying, but it's not painful at all.
And it doesn't come at a cost of a painful experience that you have to go through. With TMS, the process is not burdensome. I found it very easy right from the beginning.
At Achieve TMS East, we schedule appointments so that technicians have enough time to disinfect the equipment between each use. And remember, each patient has their own cap every appointment as well. This scheduling also ensures little to no contact with other patients in the waiting room. With the recent COVID-19 epidemic, our technicians are taking extra precautions. Now all doorknobs and waiting rooms are disinfected between each patient as well. Now we will show you a brief presentation that we usually show at all of our lunches and open houses. If you have any questions following this presentation, feel free to reach out to us and speak to any of our staff members at any time. Thank you and enjoy the presentation.
Welcome to Achieve TMS East presentation on TMS and how it treats major depression and OCD. About Achieve TMS East, we're a mission-driven organization dedicated to helping those suffering from major depression and OCD using deep TMS therapy, transcranial magnetic stimulation. We look to collaborate closely with community providers. Our clinical team strives to provide outstanding, high-quality care and give hope to our patients in a positive and supportive environment. To start off this presentation, the first thing I would like to bring up is the prevalence of treatment-resistant depression. A couple of facts for you on this page that stand out. 1 out of 6 Americans will suffer a major depressive episode in his lifetime or her lifetime, which is about 15 million a year. But the big stat on this page is the population that is resistant to any drug therapy. If you look over here to the right, 32% are resistant to any drug therapy. That's about a third of major depression diagnoses are treatment resistant to drug therapy. And we get that from the STAR-D study. We're going to take a look at that now. What the STAR-D study shows you is the likelihood of achieving remission while suffering from major depression. This study was done with 2,700 patients suffering from major depression, all put on an SSRI called Celexa for their first line of treatment. 27% were able to reach remission, but 70% weren't able to or see a good response. They were brought to their second line of medication where they're given a choice to pick between adding to their Celexa or doing a combination of medications. Only 21% were able to reach remission. If you look here, we're going to continue that trend to our second, to our third, to our fourth medication. And by the time you get to your fourth medication, you have a less than 10% chance of reaching remission. So that's who we're looking to help with our treatment today, those people that are looking for an alternative treatment to medication since their medication hasn't been working. what happens in the brain when a person is depressed? There's a couple things that happen. The main target area of our treatment is the prefrontal cortex. And you can see in this slide right here, the difference between a chronically depressed brain and a healthy brain. On the left, the frontal cortex, you can see has metabolism and blood flow. And then you look over at the chronically depressed and you can see the lack of metabolism and blood flow. TMS does help with metabolism and blood flow, but it's not the main course of treatment. Major depression order. What areas of the brain are suffering from major depression? What's the target area of TMS? How is TMS going to work? I'm going to explain it all in our next two slides right here. So when someone's suffering from major depressive disorder, there's areas of the brain that are hypoactive. Hypoactive means these areas of the brain are shut down. The neurons aren't firing. They aren't communicating with other areas of the brain. What we're going to do with TMS is we're going to send a 2-second pulse, roughly 55 times in a treatment course, to the left prefrontal cortex of the brain. What this is going to do, it's going to stimulate these areas and these neurons and refire the neurons to get them to refire, to rewire. When we do this, this will help these areas of the brain that are hypoactive become active. And this will allow the neurons to stay firing, help communicate with the neurotransmitters, help recreate new neural pathways, and help restore brain function and get rid of the depression. Next is, how come I'm just hearing about TMS, or where's TMS been? How come insurance is just covering it? It's all explained right here. We have a little history for you of the deep TMS timeline here. The first time TMS was actually used was in 1985 by Dr. Barker. He was able to perform the first TMS stimulation on the motor cortex strip. This is breaking news, especially in 1985 when you have to crack open the skull to stimulate that area of the brain. So this is big that you don't have to do that. But really in 1995 is when they realized the stimulation had an effect on depression. And then that's where it became studied. Can the stimulation of TMS make an effect on depression? In 2000, the National Institute of Health developed a coil bought by Brainsway, the manufacturing company of deep TMS. And this coil, is in the helmet we use today. If you look in 2013, the FDA approved the deep TMS helmet, which is the helmet that we use in all our treatment centers throughout Massachusetts and Connecticut. But if you look in 2008, there's another TMS model that was first FDA approved, which is called Surface TMS. What's the difference between the two? Surface TMS has a figure-8 coil. It's an older model, but they do have a newer model, but you can see in this picture really the area that it targets, the center area of that figure-8, and that can penetrate about 2 to 3 centimeters. Deep TMS, we use an H1 coil, which was developed by the National Institute of Health and is in the helmet that we use. This TMS device can penetrate roughly 4 to 6 centimeters, which can hit those underlying areas that I showed you previously in the brain slide. This is the FDA study between the two. Deep TMS's results and surface TMS's, this is not head-to-head. We just put them next to each other. If you look, there's one thing I'd like to tell you about the study first. It's a pretty cold-hearted study where people were taken off the medication. People are suffering from major depression. They weren't allowed to be in therapy, and the technicians that administered the treatment weren't allowed to be personable or friendly. So it's pretty cold-hearted, but they really wanted to make sure TMS was the reason why people were getting better. And if you look here, you can see the results with about 40% of people seeing a response with deep TMS and about 32% reaching remission. Now, response means 50% or more of depression symptoms are gone, and remission means 80% or more of depression symptoms gone. And if you look at surface TMS, the results aren't as good. This next study is actually a head-to-head study that was published in July of 2019. It's the first head-to-head study done on TMS, surface TMS, and deep TMS. It was done in Croatia, a pretty large study with 550 beds, 11 buildings, 43 psychiatrists, close to 200 partial hospital patients, a really big study for TMS. In this study, patients all were suffering from major depression, and they were put into a randomization selection. They were either put into the H1 coil, H-coil arm, which is our treatment, or a control arm, which is medication, or the 8-coil arm, which is surface TMS. And with that scenario, here are the results after 4 weeks. After 4 weeks, patients with the H1 coil, the coil that we use today, have the best results with seeing a response of 72%. Next came in the figure 8 coil, roughly around 44%, and lastly, medication around 26%. Of these responses, patients that reached remission, meaning 80% or more of their symptoms were gone, again, the H1 coil shows the best results at 65%. Figure 8 coil coming in second, again at 43%, and then medication, once again, at the lowest at 12.5%. This final study here is the study that represents Achieve, kind of more towards a clinical setting. This was done in 2009 by Brainsway. This study, we have people suffering from major depression. They did 30 treatments, and the technicians were allowed to be friendly, empathetic towards them. They stayed on a medication, and they continued therapy. That's the scenario. That's what we are looking for at Achieve. That you're on a medication that's working. You're in therapy. Then you meet our techs. They can be personable with you, and then you add on the TMS, and these are the results of the treatment. As you can see, the results are pretty phenomenal for deep TMS. About 75% of patients see a response, again, meaning 50% or more of their symptoms are gone, and 51% reach remission, meaning 80% or more of their symptoms are gone. What if you want to refer someone, or you want to, refer yourself to us? How can you do that? You can have your provider refer to us, a primary care therapist, psychiatrist, or you could just reach out to us yourself and set up an appointment. Very easy. What we'll have you do is come in, fill out some paperwork, get you some releases filled out for your providers. So that's why we allow people to self-refer. Who can get this treatment? Anyone that's 18 and older. We'll go all the way up. Sometimes we'll do 16, 17, but it has to be really good cases. They'll have to have the major depression diagnosis, multiple medication failures, tried different therapies. But again, we will look at the cases. We do have multiple child psychiatrists, so we are willing to look at those cases. Once someone decides to come in, everyone is offered a free 30-minute informational session. Reason being, we want people to be able to come into our offices and check it out, learn more about TMS, meet our technician, get comfortable with the treatment that they're about to go under, and lastly, understand the treatment they're about to get. If you decide to go forward after the free 30-minute informational session, we set you up for a psych evaluation with our psychiatrist. This appointment is about an hour long, and they are seeing if you're fit for TMS. If they feel like you're fit for TMS, we will submit your prior authorization to insurance. And if that gets approved, we will start your first treatment day with the cortical mapping with the psychiatrist and technician. And then treatment will begin right after. What's the treatment regimen like? So this treatment, it is a commitment. It's 36 treatments. It's about a 9-week treatment course. The first 6 weeks is Monday through Friday. So yes, it is a commitment, but the good thing about it is appointments only take about 30 minutes. You can drive yourself to and from. Treatment's pretty non-invasive. It lasts 20 minutes, so you're in and out, and you can continue with your day. So that's the good thing about TMS. You're not going to stop your day coming into our treatment. We have people that come in, before they go to work, on their lunch break, at the end of their day. So this treatment can fit into your daily routine without really interfering other things. So once you get through that first 6 weeks of Monday through Friday, you'll now go to a tapering period of about 3 weeks, which you'll come in 2 times a week for treatment, and we'll taper you off. Once you finish treatment, we implement a follow-up plan with our psychiatrists, and that will be for about a year. We'll follow up to see how you're doing after treatment. Dropout rate in studies is around 7%. Our dropout rate is probably around the same. This is due to sensory issues and substance abuse mostly. Side effects of TMS. You may be wondering, what are the side effects of TMS since we're stimulating the brain with a magnet? It can be intimidating, but let me tell you, there's no real side effects of TMS. The first thing we're going to look at here, no systemic side effects. So like medications, you won't be dealing with nausea, sexual dysfunction, loss of appetite. The second one, no adverse effect on cognition, like ECT. ECT affects your memory. TMS does not affect your memory. It's actually going to help with clarity and focus. Neck pain. This was reported into the FDA study. We do not see a lot of reports of neck pain, but we do list it here. We're strapping you into a helmet for a treatment that takes about 20 minutes. So we do try to remind our patients that you can move and don't try to be stiff. The biggest side effect I would say is headaches. This is about 20% of our patients experience a headache in the first week. This is a pretty minor headache that'll go away after treatment with Tylenol or Advil. Nothing too serious, but after the first week, you shouldn't be dealing with this headache anymore. Next is minor fatigue. This was not listed in the FDA study. We report this. We've had patients say that they deal with some fatigue. We're not sure if it's from the TMS treatment or if it's from having the 36 appointments, but we do like to list it because some people experience it. No seizures with TMS during the clinical studies. So the risk of a seizure is like starting Wellbutrin. It's like 1 in 1,000, so it's a pretty low risk. We do also take precaution with this and ask a series of questions every day before treatment to check your seizure threshold. Contraindications, what would stop you from getting this treatment? So metal in your head. So if you had a metal implant put in your head, what we'll do is have you sign a release for a neurosurgeon and your doctor's primary care to do some digging into what that metal was made out of. If it's a more recent surgery, they now use titanium, which we can treat, so that is allowed. The next one is pacemakers. So this is pretty much the same thing. We'll check the material, but if it's shoulders down, it's usually fine. History of seizures or epilepsy, case by case. The seizures have to be under control. You had a seizure last week and then you came in for TMS. That's probably not the best bet. Substance abuse, that lower seizure threshold. So substance abuse, if you're abusing alcohol, methadone products, marijuana, anything like that, TMS will not be your first line of treatment. We would want you sober for about 4 weeks before you come to us. Reason being, abusing substances can change your seizure threshold, and we do not want that during treatment. Neurological conditions that increase seizure risk, we do not treat. Severe dementia, we do not treat. Pregnancy, we will treat if someone's pregnant and the side effects of their antidepressants are very harsh on them and they're looking for another answer. Insurance, what insurances cover TMS? So most insurances will cover deep TMS treatment with 3 to 4 failed medication trials. Most insurances are looking for 4 trials. Self-pay is available for 1 medication failure. This treatment was approved by the FDA for 1 medication failure. However, insurance companies look for 3 to 4. So self-pay is available, but that is out of pocket, and that's roughly $10,000. Achieve TMS East participates with a lot of insurances, most commercial insurances, Medicare, Mass Health. If you do not see your insurance listed on here, we probably do single case agreements with them, so don't hesitate to reach out. Other potential indications, we're actually now approved, FDA approved for treatment-resistant OCD. Insurance isn't covering this yet, but we are starting to take on cases one by one with our OCD helmets in certain offices. Next is bipolar depression. This is being studied. Next, nicotine addiction. This is actually looking like to be the next FDA approval. So hopefully we'll be able to make an impact there. And then lastly, our TMS device was put into the opioid addiction study in December. So we're hoping that the TMS device can make a difference there. Why pick Achieve TMS East? So there's a couple things I'd like to point out to you that makes Achieve TMS East so great. Not only do we use the groundbreaking technology of deep TMS, the dTMS offers that superior results, but also down the road we'll be able to treat other indications. Next, patients continue current treatment plans with existing providers. So we don't take you out of your therapy or switch your psychiatrist, any of that. We strictly do TMS and look to work with your provider. We'll send them reports of how you did with treatment. Any questions they have, we can discuss that with them going forward. And that's one big part about us, is the ongoing communication with providers. No waiting list for your first appointment. So we'll definitely get you right in. Make a call to us if you want that free 30-minute informational session. We can get you in that week. Once we get you in, you'll be able to meet the technician, see the office. You'll be treated at, fill out the main paperwork, ask any questions you have going forward, and then we'll start the process. Our Achieve team will handle prior authorization with insurance. We have an insurance team that's really great. We've been open for almost 4 years now, so we know how to present cases to most insurance companies and really can get your case in and out and see if you'll get approved. Specialty trained clinical operations staff. So our director of operations actually comes from background in social work. She was a former LICSW for 20 plus years, has worked in inpatient, individual practice, partial hospital programs, prisons, multiple places with years of experience. She's leading our clinical operation team with, the focus on the patients, really. The next great thing we offer is flexible extended hours. This treatment is a commitment to some and to most. So we do offer 7 to 7 hours. We like being open so, people can come before they got to work, or, they go work a 9 to 5 and they stop for treatment and then go home after. And lastly, we like to offer a comfortable outpatient office with Netflix. We like these settings to be nice and cozy. You come in, you're not feeling like you're, in this setting that's intimidating or anything like that. You're going to come into our nice offices where our techs will greet you, sit you down in the treatment chair, and you'll continue your treatment, watching Netflix throughout, and then on with your day from there.
Well, thank you all for coming to Achieve TMS East virtual open house. We hope you learned something new and we hope you enjoyed it. If you have any questions, feel free to call us or visit our website and reach out to us at any time. If you don't hear from us right away, we will call you back as soon as possible. Thank you so much again and have a great day.